day has finally arrived. As many of you know, I have been counting down to surgery for several months, and I am sort of looking forward to getting it over with. COVID test has all gone in, and we are ready for the off. Here I am in the preoperative waiting room, mask on and ready to go, and getting nervous. They actually managed to get a vein, which was even more amazing. Hi guys, I'm back from theatre. As you can see, I'm feeling a bit groggy and the pain is quite significant, but they're keeping it under control. I have to say they've been really good, and I'll give you more tomorrow because I'm making things beep. I'm off oxygen, so I can now leave the HDU. The pain is still quite significant, but they're getting a handle on that with various things. So I'll speak to you later. I just realised what my lips look like on this video. I'm terribly sorry. We are trying to sort them out. But because I can get dehydrated very easily because of like my not having half of my colon, it tends to make my lips split a lot, and because I haven't been able to have a lot of my extra vitamins either, which sort of helped to stop this happening. So hopefully next time you see me I might be feeling more like myself. Hi guys, I'm just trying to do an update for you all. Thank you for your patience and stuff. I've been feeling quite rough after my surgery, which went very well, but now I'm having problems, not as such from the pain from the surgery, although that is playing a part in it, but it's giving me more problems with spasms. So we're trying to get that under control, and also I'm having some vision, because I have some vision issues anyway, so I'm seeing kind of double of a lot of things, but that's not unusual for me. So it's been difficult for me to type responses of like to WhatsApp groups and Facebook and things. So I hope to speak to you again soon when I'm feeling a lot better. I had some physiotherapy yesterday and the day before, but I've now developed a pressure sore, which meant that I've been somewhat mangled, in the sense that I've had to keep being turned over, and that has made me feel really knocked about. So I'll hopefully see you guys soon. Hi guys, this is just a quick update to say this is the third ward I've been on, and I'm now in a private room because I think they may have increased COVID precautions, and also they've closed as many wards as possible, so they've put us here on what is usually a private wing to recover, so we shall see what happens. I look rather rough at the moment. I wouldn't normally come on screen looking this bad, but I wanted to document the whole experience in the raw, because basically I can't have family visitors, and sometimes you want to look back at these things and look at your progress and all sorts of things like that, and not that it's nice to look back on, but sometimes it's nice to see how far you've come. So here I am. I did some sitting out and rolling around in my chair today, so that's good. I still look a little dark around the eyes, but then I am slightly anemic after surgery, but that seems to be resolving itself slowly, and I haven't been anemic enough to require a blood transfusion, so that was good. And I'm starting to recover some energy. I just hope the nurse I hope there's a nurse on who will do hair washing tomorrow, because the nurse who's been doing it every week has, I don't think she's worked today, and they've been very busy trying to discharge everybody they can. So that's about as good as we could hope for, and I think we're now here for the Christmas break. And it's a very sort of smart room. I think it's the smallest of the private rooms, because it's not general to have private rooms when you undergo NHS treatment unless you're contagious. But this is an actual private wing of an NHS hospital. So it does have singular rooms, which are very good. Just realising how bad my skin looks. I'll have to attend to that when I get home, or hopefully when I get out of here. So things are improving, but they are going mind-bendingly slowly. But having said that, I don't regret having it done in the least. The pain from my hip is much less. The problem I have now is the spasm issue, and the fact that a lot of my muscles have become tight because of the position I've had to live in or be placed in for pressure sores and things. The sores have now healed, so we shall see what happens from now on. So I shall say good night to you. This is Christmas Eve, so I hope you guys are getting to spend Christmas with your family. I've FaceTimed my family, and I'll FaceTime them tomorrow. I was slightly upset that we couldn't eat Christmas dinner on the ward with the people we'd been with for the last month, or at least one of the ladies I've been with for the past month. But hopefully I'll find some way of communicating. Some very lovely philanthropist has sent us a nightie. Good morning, guys. This is day 30 something in hospital after my hip excision procedure. Things are starting to look on the up, at least, apart from my appearance. That is, sorry, it's a bit raggedy because there's extremely short staffing levels due to COVID, and you can't sort of ask them to help you with stuff that's not necessary, or at least I don't feel like I am, because it's not fair when people are seriously ill and alarms are going off and things, and nobody sees me anyway. Well, apart from half of YouTube when this video is finished, but never mind. You can click off if you find me too repulsive. But things are finally looking up. I'll insert a picture to show you the tilting space chair which Dad and I found and ordered, and that seemed to work well yesterday. I'm hoping I get a chance to use it again, and I'm hoping either a new enhanced care package comes through from social services, which are all pressed at the moment, or something they call a step-down bed, which is halfway between a home and hospital. There's also talk of short-term care home respite, or something called reablement, but I think somebody's got their wires crossed with that one. I don't think they realised I was disabled when I came in here, and I'm almost back to my baseline level of capability anyway. So I'm going to try and have a word with whoever deals with stuff and do a few phone calls and ringing today,
And good grief, my hair looks like Harry Potter gone wrong. But other than that, there's nothing much more to report. Days are long, slightly monotonous, and occasionally painful, but it's all been worthwhile. I think it will all be worthwhile in the end. I'm determined that by this time next year I'll be in a completely different place physically, or at least comparatively in the cerebral palsy term, which means I'll be able to sit up in a wheelchair and go to places. And I'd like to be able to, there is a slim chance I'll be able to weight bear on this leg, depending on how things heal. It's not a for sure thing, but it is a possibility, and I'm trying to aim for that eventually. But I shall talk to you all soon. Okay, bye. Hi guys, Comet. I'm just making a video to document my last night here. I'm being moved tomorrow to an intermediate care place that's supposed to have a neurological specialism. And I can't tell you how grateful I will be to be out of here. The nurses and nursing staff have been fantastic. Other aspects, well, most of the staff have been fantastic actually, other aspects not so much. So as I was saying before I was interrupted, tomorrow I'm off to a intermediate care or rehab facility while various agencies get their act together and resource my care. And I am also probably going to get some physio that I don't have to pay out of pocket for, so I'm pleased about that. Hopefully, I'm hoping I'm not jumping from the frying pan into the fire. I have to say, it's been some of the best nursing experience I've ever had, but other experiences not so good, as I've said, but I still don't regret the operation. I can move my leg and I've got space. Like, my legs aren't welded together with spasticity anymore, and the sores I've had in my peritoneal area and in my sacrum have now, well, they've either healed up or are starting to heal up, and the sore on my side has also healed up, so I'm pleased about that. So, but I have to say I am over the moon to be out of here, and I'll check in with you when we get to the next destination. I hope it's got a shower chair I can access. I better start praying for that one. And some sort, I think from what I can see from the video, at least the patients look a lot more like me than the patients on here in terms of need and the type of physio and therapies they're receiving. So in a way, I'm hoping I can get some decent benefit from it before I go home. And other than missing the cats, I want to go home desperately, but in a way I also want therapies to make the most of this operation. I'll be back here in about 6 weeks as an outpatient to see how the surgery is progressing. But having said that, I'm having major reservations about having the second side done and the contractures released because of what a complete mare getting, oh, sorry for my American viewers. Where I live, we often say mare instead of nightmare. It's been a nightmare trying to get agencies to communicate across a sort of county line. So I would be very reluctant to try and do this again. Also, the staff that have really mattered, like the occupational therapy staff, haven't sort of taken on board the things I have said in the way I would have expected, given the fact that I am fairly older than at least some of them, and I do have CP. I know what I can and can't do, and I never considered myself as particularly a lazy person. Before all this hip happened, I used to be up and down the country and going to conferences and writing papers and all that kind of thing, and I've been absolutely desperate to get back to that. But in many respects, I've been made to feel lazy, like I'm not trying hard enough, like I don't know my own mind, I don't have capacity to make a decision. That's been the best one. And the icing on the cake of that one was being told that my dad wasn't qualified to look after me. So that kind of reduced me to a complete mess and really worries me for my future, because I am on my own in the immediate sense. Other than my dad, I do have a brother, but he lives a few 100 miles away, and has his own family. I mean, he's done a lot to resource me an appropriate chair, because even though it's been a hospital, they haven't been able to use another department's equipment, partly because of COVID and partly because apparently the spinal injuries department is very protective of their equipment. So we had to rent our own wheelchair. That was not the worst thing that's happened here. I only wish it was. But I would have to be seriously convinced and put major other things in place if I ever had the second stage of this, I have to say. I mean, in many ways I'd love to have the second stage because of what I think it has the capacity to offer me in terms of freedom and independence. But I am so insanely worried about the lack of care, attention and knowledge that there is given to adults with cerebral palsy, that I am more worried about ending up in a permanent care facility if I have another operation than I am at dealing with the pain of having another operation, if that makes sense. So anyway, I'll check in when I am more on home turf, and I will see you all soon. Hi guys, this is the morning of departure, and as you can see, I'm all packed up and ready to go. I can't wait to go somewhere where I can actually have a shower for myself and start regaining some independence. And I'm trying to work out how you flip the screen now. They've done this update on the iPhone. Sorry if it's a bit jerky. You can see all my packed stuff. And truthfully, I can't wait to leave and start the next stage of this crazy journey I've been on for the last 8 weeks. This was my bedroom at the intermediate care facility. Of all the care facilities I've ever seen, it was one of the nicest. But my neighbour was very noisy, and social services were quite annoyed I was sent there when I'd already got care in place, and they were questioning my mental capacity due to what the hospital had said. But my dad managed to get me out in a week and a half. These are some pictures from when I first got home. My auntie had decorated the house, which was lovely as a welcome home thing. And it was nice to see my dad and Scout in my home turf. I had some lovely flowers off my friends Sue, Bill and Rod, which was absolutely fantastic. And it was just nice to be home. I'm trying out my track lift on my own, which was difficult but lovely. Fat cat, who I normally feed, who's a stray, broke the flat because he wasn't allowed in my absence. My cats are making themselves back at home, so I'm pleased to have them back. And this is me and Scout getting reacquainted after nearly 3 months. Okay. I just thought I'd record the end to this hospital blog, or vlog I should say, and just reiterate that I don't regret having the surgery overall, because it's got rid of the pain in my hip, but it has left me with a substantial knee problem currently, and the problems with my blood pressure being rather erratic and the autonomic dysreflexia issues seem to have been exacerbated, which is why I've got the tilting space at the moment, which is the big chair that you see. It's not my ambition to stay in that at the moment, because I'm having to push it with little wheels, which is very difficult and very calorifically unhelpful when you're trying to maintain a weight goal. I'm hoping to get a tilting space with bigger wheels. There's more choice in the USA, but less choice in this country. And I'd just like to sort of, again, mention the hodgepodge care for adults with CP in terms of surgical choice and lack of physiotherapy knowledge or physical therapy knowledge that there is. And I hope that this video at least informs people what they might expect, enables them to put in like more planning into it than I did, or at least I'm a big planner, and I thought I'd engineered out every possible problem, but I didn't factor in very inexperienced occupational therapists, evidently, because I could have come straight home from the hospital, the social worker said, because I do have mental capacity. I had care in place that was perfectly adequate, and even if the OT didn't think it was, that was my choice to make ultimately. So, but anyway, they got me out in a week and a half, but unfortunately in that time my knee deteriorated, so that's put me probably several months back, and it's going to be a very expensive few months to get things back to at least how they were when I left the hospital. So I'll bring an end to this hospital blog, and I'll speak to you all again soon.